Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with a weekly podcast of the Common Sense MD. That's what we need more of is common sense, especially in the medical world. So I'm going to give you a good piece of common sense today. It's my firm belief that every person should have their own home medical kit. And not just a first aid kit, but actually some medicines that may save you a trip to the doctor or, more importantly, the emergency room, which is a place you don't want to have to go unless you really need it. That's what it should be for. In any event, so I started thinking about what you should have, whether it's just to keep at home or on a trip, maybe even international travel, or maybe in your car, maybe to help other people with. So I started thinking about it, and I looked in my closet, and I had this old first aid kit that I had. I think I've had this since I was a kid. It says Johnson & Johnson First Aid Auto Kit. So I guess I kept it in the family car. This is old. I think this is from the 60s. If anybody out there is from the 60s, I am. So that's a pretty cool little thing. Everybody should have a first aid kit. But a first aid kit is really different than a home medical kit, because when you think about first aid kits, you're thinking about, bandages and things that you maybe need in a minor emergency. I'm talking about medications, prescription medicines that you really should have at your house, that you should get your physician to prescribe you in case of emergency, so that you can be treated. Anyway, so I started thinking about it more, and I found my medical kit here. That's kind of a doctor's bag that you would make a home visit with. Actually, my dad gave me this kit many years ago, and it had everything in it. My dad was a physician. Anywhere from stethoscopes and blood pressure cuffs to thermometers to hemostats to stop bleeding, the stitches and sutures and lidocaine and all kinds of stuff. Even I found some of these ammonium tablets in there. You should really, this is a nice thing to have at your house in case somebody passes out. Brings them right back. You see them on the sidelines of football games. I was a team physician for many years. We used to keep them on the sideline for various reasons. But so this thing has a lot of cool stuff with it. He even gave me something to a nice little pin that you could perform an emergency tracheostomy with. So he was always prepared. In any event, but I think it's your firm right as a patient to request that your doctor give you some prescriptions to take and get filled and have them from home for home use. And I'll tell you some of the medicines I think you ought to have at your house. I think you ought to have an antibiotic or more than one antibiotic on hand. Something like a Z-Pak is the simplest one you can have and can be very useful. I can't tell you how many times I have to call in Z-Paks for people. And if they had it, if it's at night or on the weekends, they couldn't get a hold of somebody, save them a trip, get an early start on a sinus infection or bronchitis, then you should have it. And there's other antibiotics that you should maybe think about, like doxycycline and a heavy hitter called Levaquin, only for really serious infections, say like you got a kidney infection, that type of thing. And a lot of this just depends on what your medical condition is. Like if you have a heart condition, you have to have nitroglycerin and some aspirin around, a full 325 aspirin that you would chew up as soon as you started getting cardiac pain. Always very useful for saving lives. I think most households should have Zofran, which is a nausea and vomiting drug that's very safe. It should be in every household. Save you a trip to the ER in case you get food poisoning or a stomach virus. Of course, have Imodium. It's over the counter for diarrhea. You should have some ibuprofen around the house for pain. You should probably have a little prednisone kit. I mean, those things can come in handy for a lot of severe cases of not only asthma, but even a severe back strain, or it's just the ultimate anti-inflammatory. Severe sunburn, sometimes we prescribe prednisone, as well as poison ivy, that type of thing. And some other viral illnesses will use it for that. I think you ought to have medicines for allergies like Benadryl, which could make you drowsy, but very helpful for a more serious allergic reaction. Of course, something like Zyrtec, Claritin, Allegra, you should have those. Maybe even a decongestant. But antacids, I love Pepcid Complete to have around. Maybe some Pepto-Bismol, which has multiple uses. Also works great for traveler's diarrhea to take with you to Mexico if you go there. I love activated charcoal. I need to do a podcast on activated charcoal tablets because they can reverse food poisoning. They're helpful in a viral gastroenteritis. They even can help you avoid alcohol toxicity. So a lot of uses for activated charcoal. I certainly have them in my house. You may even want, depending on the circumstance, like an Ativan or something to calm somebody down in an acute emergency. Low dose, that's a controlled substance, keep it locked up. You might want to think about melatonin, just for, especially if you're jet lagged, you're traveling, you need to sleep. Melatonin is great for jet lag. Dramamine is great for motion sickness. And you maybe ought to have some antivirals like Tamiflu, maybe even some antiparasitics. You should probably think about getting an EpiPen, even if you don't have a life-threatening allergy like to bee stings or to shellfish, things like that. You're more likely to save a life with an EpiPen than about anything you can do. And actually, you don't have to buy the expensive EpiPen. You can buy a vial of epinephrine and a small insulin needle. It's the same thing, just it costs dollars instead of hundreds of dollars, and learn how to use it. Like I said, aspirin, maybe nitroglycerin. Things for rashes, you should always keep some hydrocortisone cream around. And an antibacterial cream that's really comprehensive, even covers staph, is called Bactroban ointment. That's a really nice one to have. And don't forget your regular medications that you take when you travel. Keep them in stock. Even your vitamins are very important. I talk a lot about vitamins. Maybe even some glucose tablets. Having 2 type 1 diabetics in the family, I always keep glucose tablets around in case of hypoglycemia. I'll never forget one night I was kind of working the Bristol race. I think I was working for the high school football team, selling drinks and things. And I'll never forget this because there was an old man staggering down the hallway. And you think Bristol race, he's just dog drunk. Matter of fact, the police came after him. He was falling all over the place, and I went over there, and I thought this guy is not inebriated. It turns out he had a little bracelet that said he was a diabetic, and he was having a hypoglycemic episode. So we rushed over and gave him Cokes and everything. He returned to normal. So I always think about hypoglycemia in diabetics. Diabetes is so common. You need to be able to handle those emergencies for anybody, not just yourself. So have some glucose tablets around. Probiotics, especially when you're traveling, are very helpful if you're eating different kind of foods, and especially out of the country. Always have hand cleaners. Have a thermometer. Have an oxygen sensor close by. That's coming very helpful in the last 2.5 years. Even another one that I really like for different reasons is Vicks Vapor Rub. That's another one I need to do a podcast on. So many uses for Vicks Vapor Rub. Not only to put it on your chest to kind of loosen it up when you have a chest cold. But also, it really helps for preventing mosquito bites, treating mosquito bites. It works for muscle soreness. I need to do a podcast on Vicks Vapor Rub. You should keep some around the house. So I think you really ought to have a really kind of a comprehensive medical kit, including some prescription medications. Of course, keep them out of reach of young children and teach responsibility. But I think you ought to get some of these prescription medicines to have at your house and maybe save yourself a lot of grief or a trip to the emergency room. So I think that helps. This has been the Common Sense Doctor at Performance Medicine. Thanks. I'll see you next week.